Premier Heather Stefanson and Dr. Brent Rusin take the podium this afternoon for the dual purpose of announcing new public health orders, as well as announcing new economic supports for the province. These orders were delayed from last week due to a need for extra time to examine the data trends and will not go into effect until February the 8th. While we won't have full details until next week, we know that these orders will include removing the hard cap on capacity in public venues while maintaining the 50% capacity limit for the time being. This will have the largest effect in places like sporting venues where actual capacity far outstrips the cap that was in place. Other changes include loosening restrictions on private gatherings, changing the curfew on liquor sales, and allowing sports tournaments to take place. The new restrictions will be in effect for 2 weeks rather than the 4-week intervals we've seen in the past. This is due to the shorter incubation period of the Omicron variant, which means we will see the effect of the restrictions in a shorter period of time. We now join Premier Stefanson and Dr. Rusin for their announcements and media conference.
Good afternoon, everyone. Today we are here to announce two things. First, the relaxation of some of the public health orders, and secondly, more financial supports for businesses and the arts and culture sector. Last Friday, you'll recall that Minister Audrey Gordon and as well as Dr. Brent Rusin announced that the current public health orders would be extended until Tuesday, February 8th to allow for additional time to confirm the trend in the COVID-19 data and its impact on the healthcare system. We are seeing some positive trends in the data throughout the province, indicating that COVID-19 is starting to stabilize in our province. As those trends continue, I am pleased to announce as of February 8th, we will begin to lift some of the restrictions. These new measures will remain in effect for the period of 2 weeks until February 22nd. And new measures will take effect that will include changes to gatherings in private residences, retail, restaurant, licensed premises capacity, and museum and art gallery capacity, as well as capacity for sporting events. I will now pass it over to Dr. Rusin, who will fill us in on the details. Over to you, Brent.
Thank you, Premier. Good afternoon. Brent Rusin, Manitoba's Chief Provincial Public Health Officer. Last week, we announced an extension of those public health orders. We had been looking at modeling and looking at trends, many of which were showing the peak or pending peak or plateau at the time. We needed some more time to look at those trends, so we were encouraged at the time, but weren't able to make a definitive call. As this week has passed, we see that many of those indicators continue to be stable or trending in the right direction, and so we are getting a better understanding of where we are in this wave. So one of those factors that we look at, and one of the most important ones, is the strain on the healthcare system. So we look at hospital admissions, both hospital admissions and Icu admissions, those that are positive for COVID-19. So these have been very important indicators. We've broken those down in the past as infectious and those considered recovered or non-infectious at the time. But what we see is as we have widespread transmission of Omicron in the community, we see very significant numbers of people who are in hospital and test positive for COVID. So for public health, as we look at our need for restrictions and our path forward, it's really important for us to understand who's in hospital because of COVID, not in hospital incidentally related to COVID. And so it's we know that because Omicron is so widespread, we know that every person admitted to hospital is tested for Omicron. We're going to find people that were there for other reasons but happened to test positive for COVID. So when we look at hospitalizations, when we look at various ways of doing this through chart audits, we see that about 60% of those that we report that are admitted to hospital are there for reasons other than COVID. So those are people that are found to be incidentally positive for COVID. So they would be in hospital for these reasons with or without COVID. So we're looking at about 40% of those that we report in hospital are related to COVID. So this is still all those people need care. All those people that are admitted still put that strain on our healthcare providers, but it's important for us, public health looks at the need for restrictions, who is there for COVID, and so certainly we see that that split where in some days up to about 1/3 of them were there for COVID, and so it certainly helps inform our modeling. And our path forward. So when we look at ICU admissions in the same manner, that is flipped over. We see that about 2/3 of people, or about 70% of people admitted to ICU, are there for COVID. So we see that trend, that the majority of people who are COVID positive in ICU are actually there for COVID, but about 1/3 are there for reasons other than their COVID infection. And so it's certainly relevant to the way we look at our numbers. When we look at those ICU numbers, again, it's very important to highlight the importance of vaccination. We see the benefits of vaccination still protecting against severe outcomes. And why we're really pushing our way forward continues to be vaccinating as many Manitobans as we can. So any Manitoban who's eligible for any of the dose, first, second, or third, please get that as soon as possible. So it's certainly been a while since we've been able to consider easing some of these public health restrictions, and so based on from what we're seeing in things like hospital admissions and case reports, looking at absenteeism rates from different sectors, we do see it's very likely that we've hit a peak in Manitoba for case generation. We still see in ICU some of that slowing trend, but still upwards. So we can move cautiously at this point. We all know that the public health measures were in place temporarily. They're always meant to be temporarily and meant to be in place for only as long and to the degree that they are required. So the place we're at right now, we are recommending that new public health orders take effect on Tuesday, February 8th. They will be in effect for 2 weeks. And so some of those details, so loosening restrictions on private gatherings with more people allowed to be together indoors and outdoors, again with differential rules based on vaccine status. Adjusting capacity limits at many public places. So we're going to maintain the proof of vaccine requirements at the places that they're required right now. We're going to maintain the 50% capacity limits where they are right now. What we're going to do is lift that maximum cap. We had many of these places capped at 250. We're going to remove that cap. So it's still going to be proof of vaccine wherever that was required in the past, still be 50% capacity wherever that was required in the past, but removing that cap of 250 people. We've had that liquor sales to stop at 10. We're going to extend that to 12 a.m. And as far as sports, we will allow tournaments again for indoor and outdoor sports and recreation. So over those 2 weeks, we're going to continue to monitor those trends. We know that the incubation period for Omicron is shorter, and so our previous duration of restrictions were based on a much longer incubation period. So we feel that the 2 weeks is going to give us a better picture of where we're at, and again, consider a path to a further loosening of the restrictions. We know these are only in place temporarily. So we still maintain the proof of vaccination requirements. but we continue to message to Manitobans the importance of receiving those vaccines as soon as you become eligible. So we know Manitobans have largely stepped up and followed these rules. The vast majority of Manitobans have done their part and gotten vaccinated. And we all know that our path forward must be one to continue to remove these public health orders over time, but in obviously a cautious manner. So again, Manitobans have done, the actions Manitobans have taken, we're once again in this place to start loosening our public health restrictions. So thanks to all Manitobans for all of your hard work. Thanks to our healthcare workers who have given up so much during these tough times. And I'm going to pass it back to the Premier.
Thank you very much, Dr. Roussin. And while today's announcement will be welcome news to many Manitobans, we recognize that many businesses will still be impacted by restrictions, able to operate to their full capacity. And that's why today we are also announcing an expansion to the sector support program to help Manitoba businesses and arts and culture organizations through this challenging time. The expansion will provide a second payment to businesses that have been previously approved and affected by public health orders in place as of January 31st. Expand eligibility under the program to include event rentals, catering, and photographers, and extend the program intake period until February 28th of this year. Often described as the first to close and last to open, we recognize how difficult this time has been for Manitoba's vibrant arts and culture sector. We are also allocating $6 million in new funding to the Arts and Culture Sustainability Program to support organizations in this sector that are negatively impacted and affected by the COVID-19 public health order restrictions. Moving forward, we continue to consult with our public health officials and our stakeholders as we move through this pandemic and continue to learn to live with this virus. Assuming the COVID-19 data from Manitoba continues along the path that is projected, we will be in a position, hopefully, to further relax restrictions in the weeks and months ahead. Situation permitting and based off of what the data is telling us at the time, we will be looking to remove a significant amount of capacity limits and restrictions. Later this spring, we hope to be in a position of relaxing nearly all restrictions and moving to recommendations. I want to thank the over 87% of Manitobans 18 and older who have been immunized with at least 2 doses, and to those who made the choice to protect the nearly 70,000 Manitoba children with a dose of the vaccine. To date, our province has administered over 2.7 million doses of the vaccine. We know that vaccines work. I encourage Manitobans to get their 3rd dose when eligible to recharge your immunity to COVID-19. Getting your 3rd dose of the vaccine decreases your risk of needing ICU care by 139 times compared to someone who is unvaccinated. I want to thank Manitobans who have made personal, professional, and financial sacrifices and have done their part by getting vaccinated and following the fundamentals. I want to thank all of our frontline and essential service workers for helping to keep Manitobans safe during this pandemic. I am confident we will get through this together. Thank you to all of those Manitobans. And we're now open for questions.
Madam Premier, we have the 2nd highest death rate in the country due to COVID right now. We're averaging 7 deaths a day. We had 7 more today. How do you reconcile that with what you've just announced?
So what I will say is that obviously we've been working with public health to see and look at ways that we can reduce the restrictions for those out there. I think people are ready to get back to some normalcy as part of their life. When it comes to deaths and how they're reported and in comparison to other provinces, I think we are looking, and I've asked for those numbers to see, and those comparisons across other provinces to see, are we comparing apples to apples when it comes to this? And so, we're obviously looking at that. And, but to all those Manitobans, we know this has been an incredibly difficult time. We know that there has been a loss of loved ones. And what I would say is as well to Manitobans, that we will get through this together. It is a very challenging time. What we want to do is ensure, though, that all Manitobans will be able to have the access to healthcare outside of just COVID, but other things as well. And we're obviously concerned about those who are suffering from mental health and other issues out there that we need to focus on as well.
So what do you say to the elderly, disabled, and immunocompromised Manitobans who are living in fear right now? Those are the ones living in fear, not general society. That they continue to see this widespread Omicron spread. They continue to see, yes, it is milder on an individual basis, but you can, even if you talk to medical experts, they say we're underestimating COVID deaths, not overestimating them as you just implied. What do you say to the families and people who are disabled, immunocompromised, and elderly?
What I would say first and foremost is get vaccinated and make sure you're fully up to being vaccinated and you get the extra dose, the third dose as well. I think that, obviously these are very, very challenging times. We don't want people to be living in fear. What we want to do is create an environment here that Manitobans don't have to live in fear.
So you're suggesting those people aren't vaccinated? Is that what you're saying?
No, to the extent that they're not, then they should be, but I believe that most of them are. But to their families and loved ones who may not be, to those people as well, to encourage as many Manitobans to get vaccinated as
I
possible.
understand the vaccination messaging that you often go to. I appreciate that. It's an important message. But I can
It
ask
is
you
an
one
important
last time.
message.
What do you have to say to vaccinated people who are immunocompromised, elderly, or disabled?
I would say that we've had, restrictions in place to try and help, with our hospital system. I think what we're seeing, and I'll ask Brent to maybe comment on this in terms of the number of people in hospital, the hospitalization numbers and ICU numbers that we've seen, plateau. And I think that, that's what the restrictions were in place for. As we're starting to see the movement towards the trend that we are, I think we're in a position to be able to reduce those restrictions so people can get back to living their lives.
How much of this was demanded by businesses? And I'm talking specifically about the removal of the 250-person cap. We're now going to see thousands of people in large venues like the downtown hockey arena and some casinos potentially. Is that not an additional risk? And who asked for that cap to be lifted?
So what I would say is that certainly we are listening to those in the business community. You recall 3-4 weeks ago when we extended the orders then, and we extended it another week. Businesses are constantly reaching out and giving us their perspective. It's why we've announced further supports for some of those businesses today. With respect to the orders that are before us today, I'll ask Brent as well to comment on these. These are things that we work together with public health on.
Yeah, and so this follows our typical approach to as when we were loosening restrictions, we loosened them in the reverse order of what we put them on. So we added these restrictions late, and you'll see, and then those were the first now to be removed. So it's pretty standard approach that we've had for our cautious loosening of restrictions over time.
And despite the, all the evidence we've seen is that if you're fully vaccinated and you're not immunocompromised, the chance of having very severe outcomes from Omicron is quite low. But if you have a large crowd, you will get immunocompromised and people at risk in that crowd. Are you comfortable with allowing thousands of people in an area, even if they have to be fully vaccinated?
So, the risk will never be zero, right? So people who are living with immune compromise, with severe medical conditions, they've always been at risk of many different things. They've been at risk every respiratory virus season as well. And if we see another variant or who knows what COVID will do next respiratory virus season. People who are in those conditions are unfortunately at increased risk. We have a lot of measures still in place. So we do have proof of vaccine requirements. We have masking that will be required. We'll never have a zero risk. And then some, people will have to consider some of their own risks as well, like in pre-pandemic times. as well. And we were messaging this from the first wave of the pandemic, that if you're at increased risk, you need to reconsider how much activities you take place. So even before we had our first restrictions, we always had that high risk messaging as well, and that doesn't change.
The reason Manitoba hasn't gone with a 2-household bubble formula like some other provinces have, to limit that extended, prolonged, close indoor contact that we see in household gatherings?
You know, with the private gatherings, I think every jurisdiction has struggled with what's the right way to do this, right? And it's a balance between, one is we want to limit contacts, but we need to do so through messaging and through orders that are really difficult to enforce. And so what's the best way to do that? What's the clear way of doing it? Do we say it's one other bubble or 2 other bubbles? What does that bubble make up? Or do we say list a specific number? And so I think every jurisdiction has struggled that. We've considered it, and I think we've taken different approaches before. I think it's really challenging to limit gatherings in a private residence. It's important, but I think most of that relates to to our messaging. To do whatever you can to reduce those gatherings. And then, of course, if you're at increased risk of severe outcomes, then you need to consider reducing those even more.
Dr. Roussin, medical professionals have clapped back at this notion of with COVID, from COVID, saying that a lot of people, they're not there primarily because of COVID, but COVID is a systemic illness, and it causes a lot, and exacerbates other problems. They also say that there's a lot of people not getting medical care right now for all variety of reasons in the health system, because there is so many COVID infections, even the ones that you classify as strictly COVID. So I know you're not from the shared health system side here, but what do you say to those doctors that say that really we're still really struggling in the healthcare system right now?
Well, I think there's certainly strain in the healthcare system for lots of reasons, right? As we've seen absenteeism, we've seen the strain over 2 years. There's backlogs and things. So there's no doubt there is that strain. Do we use public health restrictions and remove liberties solely based on that strain? If the strain isn't entirely based on directly related to COVID. These are kind of those balancing the challenge we have. So when you talk about the roughly 60% of the hospital admissions that we announce each day, if they would be there either way, they're there regardless of COVID. They just happen to have COVID. It's certainly not irrelevant. It's certainly relevant to how we consider moving forward with our restrictions. But no doubt is that in any way saying to depict that there isn't a strain on the system, but it's certainly relevant to us that 60% of the people there would be there regardless of COVID. So when we're looking at our restrictions, it's something we need to consider, but absolutely the message is not to say that there isn't a strain on the healthcare system. There's lots of reasons for that.
Premier, since you were appointed Premier, have you gone to visit a hospital yourself, an ER, an ICU, to see it yourself firsthand?
Trying to think if I have been in. I guess not since I've been Premier. No, I haven't.
Why not?
I think it's out of respect for for the public health orders, and not wanting to be in a position where I'm going in and potentially infecting further. I think we're certainly in discussions, and I rely on our Minister of Health. To reach out in those circumstances. I certainly am not opposed to going and doing that. It's basically been out of an abundance of caution, I would say.
Premier, in mid-December, we had around $381 million left in contingency for COVID-related things. I know that we've spent 22 on more business supports, and I'm guessing that's what you're matching today. So how much is left, and why not offer more to buy some more time?
Yeah, certainly, we offer these programs out there, and then we see what the uptake is, and we try and change them accordingly to ensure that we can offer more supports to as many Manitobans as we can. And so what we have heard from the business community, from the chambers and others, that they appreciate these supports. To the extent that there's more that we can do, I think we are doing more. We are reaching out now to the arts and culture sector. There may be some other supports that are needed down the road, and we'll gauge what those will be and take it from there.
We have time for 2 more questions before we go to the phone.
Dr. Reason, what is our supply looking like for the treatments for people who, like monoclonal antibodies, Paxlovid, et cetera?
Yeah, and so that was, we originally received roughly 1,100 treatment courses for Paxlovid, the oral antiviral, and so that is run through Shared Health, so details on the distribution thus far should go to them.
Premier, you've spoken up in favor of vaccination. Your health minister's called herself a vaccine ambassador, but not everybody in your caucus is acting like a vaccine ambassador. I'm just wondering, why is that, and is there anything that you can do to encourage your caucus to be more vaccine ambassadorial? I don't know what the proper term is, but and can you do that while maintaining your support in those areas of Manitoba without alienating people in Winnipeg, where most of the voters are, who will see that your government gets reelected or not?
Yeah, I think what's really important is that as a government from day one, once the vaccines were released, we all became ambassadors within government to ensure that as many Manitobans got vaccinated as possible. To the extent that those were in positions that were saying some things contrary to that, they've been removed from those positions. We'll continue to have those discussions in caucus. I think it's very important that caucus members have the ability to represent their communities. We have a very diverse group of individuals within our caucus. They have every right to represent their constituencies, those that elected them, and so we have those discussions in caucus.
But if they're
We can
undermining
go to
the
the phone right
message.
now, Carol. We'll come back to the room after. Thanks.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from City News, Mike.
Good afternoon, Mike Albanese from City News. My question is, with all the other loosenings of restrictions, Manitobans were able to look at tangible stats and see that infections were on a downtrend, that less people were testing positive. But with the current restrictions to testing, we can't necessarily go and see how many people are infected with the virus. A lot has to just go on the word of public health officials. So, Dr. Roussin, what can you tell Manitobans to make them more comfortable with the fact that we are restricting while there could still be a lot of virus in the province?
Yeah, well, we know there is a lot of virus, right? And so if we thought that there was really no risk, we would loosen, lift all the restrictions. So, but we're not. We're doing so in a very cautious manner. We presented modeling last week that shows where that peak likely has been, and the path forward. We redid those models, and they show us the same thing this week, that we've very likely peaked in cases, very likely peaked in hospital admissions, and are either peaking or peaking soon regarding admissions to ICU. We look at industries or sectors where there is much more frequent testing, and look at absenteeism rates and their test rates, and we see those are all showing us a peak a week or two ago. So there's a number of indicators that we look at, and we presented those the modeling last week. So you're right, things have changed in the way we look at things because of the testing approach, but we still have a number of indicators that we've presented.
Thanks for that answer. And with the loosening of restrictions, I know we're not pulling all restrictions right away, but that does add variability. Do our projected numbers, our projected cases, our projected future outcome, does that not go a little out the window when we start adding these variables in, as such as not a cap of 250 people at a hockey game could have tens of thousands?
So it's why we, continue to message many of the factors, the fundamentals that we talk about. It's why we move things very cautiously to see those effects. And because you're right, there is some unpredictability when we loosen certain measures. There's just no way, around that, and that's why we move cautiously and evaluate the effect before we loosen. So I think, again, these measures, the public health restrictions, they have negative effects as well. And so it's a matter of trying to find that balance, which is difficult. But we feel, based on the modeling, based on numbers, we see this as a pragmatic approach at this point.
From CTV Winnipeg, Jeff.
Oh, hi. Hopefully you can hear me okay. I had trouble getting in. I'm just wondering, Dr. Rusin, Steve's already asked about it, but I take it then with the lifting of that cap, I guess the Jets can start having, if they want, higher capacity limits?
That's correct. Yeah. So venues such as that, sporting venues, would be proof of vaccine, 50% capacity, masking, but there isn't a cap on the total.
Okay, and both yourself and the Premier have alluded to this, but do you have a timeline mapped out, after the next 2 weeks of, like other provinces have done, like, here are some key dates for when we're going to start to loosen other restrictions? Do you have kind of a map?
Well, certainly it's a thing that we're always discussing, the short-term and medium and long-term approaches to things. So we don't have specific dates, and it's really challenging to come up with specific dates. I think the message is that, given where we are right now, if we don't see anything unexpected, that we're looking at a restriction-free Manitoba by spring.
From CHVN, Taylor.
Hi, good afternoon. I'm looking at the health orders here, and I see that for places of worship, there was quite a big jump in how many people could attend, particularly without proof of vaccination requirements. Can you tell me a little bit more about why you decided to do this?
Well, so this is referring to the. Yeah. So we have in place of worship right now, there's a 50% capacity with no cap, similar to other places. They had a 25% capacity, or 25 people, although they could get to 250 people if they cohorted. So at this measure, we just loosen that, remove the cohort requirement. So it's 25% capacity or 250, whichever's lower, but not the need to cohort.
Thanks. And when you were making these orders, what did you hear from religious leaders about this?
Yeah, so with public health, again, when we are loosening restrictions, we sort of just go in the the reverse order of them coming in. So this is a very modest loosening of these restrictions. So public health hasn't engaged with religious leaders at this point. This is all about a cautious reopening when we're just seeing our numbers starting to plateau. So we only felt a very cautious reopening at this point was warranted.
As well, obviously, we have a ministerial working group that works very closely with stakeholders in the community, including our faith-based community as well. So we're in constant contact with them about the orders as well. They reach out from time to time. We reach out to them, and we, as we do with all stakeholders.
From CJOB, Skylar.
Hi, guys. I know I asked you, Dr. Rusin, about this last week. Just looking for a little more context to some of these hospitalization numbers. I know we have, around 1,500 medical beds in the province. Maybe a couple hundred of them were open last week, if that. And of course, now you're providing the, with or because of type data. But in terms of context, where does this, compared to, say, like 2019, 2018, when the hospitals were filling up slightly because of the flu. Obviously, we're seeing way more deaths because of COVID-19, but just trying to put that hospital situation into a little more context for people.
Yeah, and so, I mean, it's a good question. I think I'm going to let Shared Health answer any details of that. There's a lot of context that we have to put into place now. There's staffing issues right now that we didn't have, say, in 2018. There are issues on, delayed surgeries and things of that. So it's not going to be essentially an apples to apples comparison on how many people were admitted this time in 2018 compared to right now. But the details of that I'll allow Shared Health to answer.
Okay, I appreciate that. And just as my follow-up, we're looking at potentially a restriction-free Manitoba in just 2 or 3 months' time. A lot of people may not be comfortable with that, but it is the beginning of this clawing back of restriction kind of ushering in an era where folks who are immunocompromised, are elderly, are at higher risk of some severe outcomes, need to take that responsibility into their own hands, and it's not being put on the general public with broader orders. Is that kind of the era we're going into now?
Well, I mean, I think that's our pre-pandemic era, right? We faced many health challenges pre-pandemic. We unfortunately saw many deaths and severe outcomes every respiratory virus season, and the majority of those occurred in unvaccinated people, and as well as people with many underlying conditions, those who are older, those who are immune compromised. So, when speaking about this, you never want to downplay the tragedy of all of these events. But moving forward, we do have to find ways out of these public health restrictions, because we know we're always going to have challenges on some of the sickest Manitobans, and so we definitely need to find ways to protect them, but it can't be to restrict the entire population forever. We've been at this for 2 years. At some point, we have to find a way out of that.
From CBC Radio Canada, Godlove.
Yes, good afternoon. Good afternoon. I just want to raise a concern about the truckers with the Premier, because we know the truckers are coming back. There was a legislative assistant who was expelled because of his support to the truckers. And now those truckers are planning to have a sitting in front of the Winnipeg legislature. Hello?
Yes, we can hear you.
Yeah, so they're planning to have a sitting in front of the Winnipeg legislature as from Friday until you relax restrictions. What will you do, Premier, please?
Obviously, we want to ensure that everyone is safe, and I know that on the legislative grounds that Justice will ensure that there's proper security in place to ensure the safety of all of those individuals on the ground. I do want to say that to our truckers, they have allowed us to be able to live through this pandemic. They have allowed the supply chain to continue and have supplied us with our food and our clothing to wear. And so I think we should thank them as essential service workers for what they do. I did send out a letter last week, I guess, just explaining, where I felt on many of these issues. I am concerned about the mandate that the Prime Minister put in place, because I am concerned about supply chain issues and inflationary issues. We had a different approach in Manitoba when it came to, our provincial employees, where we looked at either get vaccinated or get tested. There maybe is another way out of this to ensure that we can continue that supply chain, which is absolutely critical for not just Manitobans, but for Canadians.
Yes, but if I just have to follow up, somebody were asking whether there is a map we can follow after February 22nd. What is coming next? You could see the part of population who were supporting the truckers. Don't you think that some people are tired of the restrictions? Is there anything? Are we going to lift more restrictions in the next weeks or the next month?
Well, I'll start off with that and then hand it over to Dr. Roussin as well for his comments. I think he's already sort of stated that this is a cautious approach to opening up, but obviously our end goal is to be able to remove all public health restrictions to ensure that Manitobans can get back to living normal lives. So I think we all have the same end goal in mind. It's just that we need to take perhaps a cautious approach through this to ensure, that our healthcare system is there for Manitobans when they need it.
From the Brandon Sun, Karen.
Good afternoon, everyone, and thank you for fielding these questions. Mine is more about enforcement, because we have a company here that was recently fined for refusing the mask mandate. I had just gotten back from a meeting with them, and just the general consensus from them and allegedly from their customer base is that they're tired of this. But also looking at stats for fines, I see a lot more have been ticketed for mask refusal or failing to comply. So is this uptick in the last 30 days because more people are refusing to wear their masks, or is there just more enforcement?
I think it could be a combination of both. I think people are generally getting, there's COVID fatigue out there. I think we've all seen it in our various communities, and we all feel it. And so, but obviously when it comes to enforcement, I know that, we have been tracking not just the ticketing side of it, but the warning side of it as well for individuals as well. So I know Justice is starting to track those numbers as well. I think what's important here today is that this is the start of the loosening of restrictions. We will be moving towards lifting all restrictions at some point when it's safe to do so. And I think that what we're asking for Manitobans is just for patience through this. Everyone's tired of the restrictions. Everyone's tired of COVID. But we need to ensure that we also take that balanced approach where it comes to, making sure that we are protecting our hospital system, but also ensuring that Manitobans can live their lives.
Okay, thank you for that. And for my follow-up, just related to that, a lot of people have been asking a lot of questions. It's been more than 2 years. A lot of money has been poured into restrictions and funding for supports. They would like to know why there hasn't exactly how much investment has been made for shoring up the healthcare system.
Yeah, well, every year we have increased the budget for healthcare. We have put special supports in place through the COVID pandemic as well, and will continue to do so. Obviously, we have a challenge with surgical and diagnostic backlogs. We have set up a task force to develop a plan to get us through that. And we'll continue to work with them closely on that. I know that's top of mind for Manitobans. So there will be more investments that will be made over time in the province of Manitoba. On Friday, our Council of Federation is getting together and meeting about this very issue with respect to the Canada Health Transfer. The federal government is going to have to come to the table and work with us on this. It's not something that provinces and territories can shoulder alone. We're all in this together, and we're going to have to ensure that we work together on it. So I appreciate your question very much.
We now return to the News Conference Theatre.
Following
a
up
few more
on,
questions in the room.
thank you. Following up on Gladlock's question about the truckers and the convoy, one of the things that the MP Bergen said in the House was that she said that the toppling of the statues and the defacing of the statues on Canada here, she said that was equivalent to the protesters who were waving Nazi flags and desecrating the War Memorial. I'm just wondering, do you think that that is a fair equivalency to compare what happened on Canada Day here with statues and angry protesters over the deaths, the graves that were found at residential schools, with the scenes of the symbols of hate that we saw on display out here in front of the building and in Ottawa with the convoy protests?
Well, we certainly understand, with residential schools, the hardships that First Nations have gone through, and we want to work with them through reconciliation and ensure that we're helping them get through this very difficult time. I don't condone any kind of violent behavior anywhere at any time. And I don't think, and I believe at the time there were some First Nations leaders who came out and said, that we don't condone, the behavior of you know, what happened there. And so, you know, I would agree with that, but there's no question that we need to work very closely with Indigenous communities to help them heal through these very difficult times. And that is, of course, a priority that I have mentioned in our throne speech. I mentioned it in my inaugural address when I became Premier. Reconciliation is a priority for our government.
That wasn't a question. Do you consider it equivalent to topple a colonial figure statue with showing a Nazi flag?
And I'll say it again, I don't condone any violent behavior anywhere. I don't think it's right.
Equivalent to that, Premier, with respect. Do
Well,
you see it's equivalent?
I do not condone any violent behavior.
What's worse though? Is one worse than the other, do you think?
I believe that question was answered by the Premier.
I've answered that
A
question.
different question, Dr. Roussin or Madame Premier, when you had this plan to relax restrictions on Tuesday, what response did you get from Perry Gray and the various specialty leads in the health system?
We have frequent discussions. Dr. Gray is part of an incident command structure as well, so we have various discussions, you know, about our approach, about their planning, and so we don't, you know, discuss necessarily the details of the response, and they're varied.
Well, it's not a big detail I'm asking for. Did you get a thumbs up, a neutral, a thumbs down? Like, what was the general tone?
Well, it's not as simple as that, right? There's various restrictions at various levels. There's, you know, we look at various scenarios with the modeling, and we take in a number of considerations, right? So their responsibility is for the acute care system and the capacity within there. We have a much broader responsibility to the overall health of Manitobans and things. So it's not as simple as just thumbs up or thumbs down.
Are you concerned what happens a year from now? If we look at we won't really get a real picture of this till we see excess death numbers through StatsCan well into 2023. So a year from now, are you confident that the approach you're taking right now is the right approach, knowing that we will see excess death numbers next year?
Well, you know what, we have to work with the numbers in front of us. We know that there are many aspects of health. And COVID is one of them. COVID is for the last 2 years has been a strong focus of the healthcare system, of public health, but it's not the only factor related to health outcomes. So when we look at the risk of COVID and talk about restrictions, we really can't do that thoroughly without looking at what the harms related to the restrictions were. And so these are very challenging things. So I know that looking back in retrospect is going to be a lot easier than having to deal with it in real time.
With small businesses on the changes to capacity, because if everybody's still at 50%, but you lift the 250 maximum, that really benefits big venues. And small venues really haven't changed if you're a licensed premises or your bar, restaurant, that sort of thing. So
Yeah, what has changed there is actually moving from 10 o'clock to midnight to allow them to be open longer as well. We recognize obviously that there are some hardships with those restaurants and those in the bars and those businesses, and obviously that's why we're introducing further supports for them today. We recognize that these are challenging times.
Premier,
Thank you very much, folks.
Did you forget about
Thank you, Kara.
the not disclosing the disposal of your assets? You were housing minister in 2019, and last week when we asked, well, you know, you had declared them as assets, and then after they were sold, there was no disclosure or statement filed saying that you had disposed of them. You were housing minister at the time, and Manitoba Housing, there were plans to devolve Manitoba Housing. Like, can you explain how there would be an oversight, like how you can forget about $30 million worth of assets being sold?
Well, first of all, Manitoba Housing has nothing to do with this, but secondly, I did disclose the disposition of those assets. So they were disposed of, and they were declared in my conflict of interest forms. The next conflict of interest form that came about in my and disclosed as well in my meeting with the conflict of interest commissioner. What the issue is that I didn't file the Form 2, I think it is, within 30 days of the disposition of those assets. So to say that these assets, the disposition of these assets was not disclosed is wrong. It was.
It wasn't in the
They
clerk's
were.
office. It wasn't in the clerk's office.
It is. It is in my conflict of interest forms, and
It is now. It wasn't for 2 years.
No, it was. It was absolutely. It was there because as I filed my new conflict of interest form, those assets were no longer there. and I have my meeting with the conflict of interest commissioner. And why are those not there? Because they've been sold. You know, so.
You're required to file a statement saying that you.
But that's the
have
Form
disclosed them.
2, which I said, you
There's
know.
no Form 2. There was no Form 2 last week and your office confirmed that.
Well, because once it's already disclosed, you can't go back and file another form. It's already disclosed.
It wasn't disclosed. It wasn't in your file and your office confirmed
Yes, it
that.
is disclosed.
No,
I would suggest you talk.
It was an oversight from your press secretary
Yeah.
that it was an oversight.
I believe you can send those questions to
I
the
have.
staff.
Well, it is disclosed. So to say that it hasn't been disclosed is
I was
wrong.
told it was an oversight and it would be disclosed immediately.
Dr. Rusin, you want to answer one more about modeling? Just I know you got on the way out, paper wants you guys to go.
We
We're done.
can send it through to the staff,
Okay,
please.
no problem.